Today, I'm going to introduce the Leaderguide implant surgical guide system that's constructed on the model. First, we should have a well-impression cast that show clear anatomical landmarks, such as retromolar pad and submandibular fossa. Then we should check occlusal relationship, such as interarch space, jaw relation, and teeth position. Next, we can look at the X-ray, such as periapical film or panoramic or CT. And draw the root morphology and long axis of the adjacent tooth. Later on, we can draw the occluding line from the cusp tip to the posterior central fossa. The next step is to measure and calculate the distance and determine the number and size of the implant. Then we can see the implant side and draw a line perpendicular to the occluding line and circle the area of the implant site. Then we can mark and locate the cast on the sphere and determine the mesial-distal and buccolingual angulation. Here are the laboratory drills and polishing brush that we use. First, we use 2.3 mm round drill to drill about 5 mm deep. Then drill with 2.3 mm twist drill to drill about 15 to 20 mm deep. After cleaning the cast, we can put 2.3 standard row into the holes. Here are the index row and guider with the resin plate. Then we estimate the area to reconstruct the surgical stand. The stand must have enough extension for stabilizing the stand while surgery. And next, we should block out cast with wax and build guiding plan with cover. And check with analyzing row to see if it is bulb out enough properly. And pen some separated on. We cut 20 minutes wide resin plate and roll into resin roll. Adapt the resin roll from lingual side and occlusal side to form the stand. And light curing for 5 minutes. After the resin is setting, we take off the stand and remove the wax and rounding and polishing the stand. First, we make the X-ray check guide with 2.2 mm index row. We can use some utility wax attached to the index row. And now we are making the Leaderguide surgical stand. First, we attach the Leaderguide on the standard row. Then adapt the resin roll onto the Leaderguide the same way to roll the resin plate to the resin roll from lingual side and occlusal side. Cut off the resin adapt the resin. Then light curing for 5 minutes. Then we retrieve the standard roll and take off surgical guide. Rounding the sharp edge and polish. Then we should check the guider to see if it can move freely up and down. If there is any undercut, that we should remove it. also can use the butt pucker to cut off the small area. Then check every guider that is can passive move smoothly up and down. Also remove the undercut under the anti-rotation clip. Make sure that each guider can move smoothly. Then we can put the stand back on the model and stand by for surgery.